Lewis, and my Medicare Medicaid group project was done with Catherine Dahl. Wanted to give you a little bit of background. Medicare is a federal government program that provides health coverage or health insurance. Who qualifies for Medicare? Generally, Medicare is available for people age 65 or older, younger people with disabilities, and people with end-stage renal disease. Medicare has two parts, A and B. You are eligible for a premium-free Part A if you're 65 or older and you or your spouse worked and paid Medicare taxes for at least 10 years. You can get Part A at age 65 without having to pay premiums. You can get it if you're receiving retirement benefits from Social Security or the Railroad Retirement Board, or if you're eligible to receive Social Security or railroad benefits but you have not yet filed them. Also, if you or your spouse has had Medicare covered government employment. The cost of it, when you apply for Medicare, you will automatically be enrolled in Part A. It covers hospital stays, hospice, and some skilled nursing care that you may need after being hospitalized. Medicare charges a deductible each time you're admitted into the hospital, and it changes annually. Part B, this part of the Medicare covers doctor's visits, labs, tests, diagnostic screenings, medical equipment, ambulance transportation, and other outpatient services. The federal government sets the Part B monthly premium, which is about $135, but may be higher if your income is more than $85,000 a year. You'll also be subjected to an annual deductible, which is currently $185, and you'll have to pay 20%. So Medicare is one of those that's on an 80-20 cut. So they pay 80% of the bill, and you pay the 20%. Part C, this plan will provide all of your Part A and Part B coverage. Medicare Advantage Plus may offer extra coverage such as vision, hearing, dental, and or health and wellness programs. Part D is, I always remember this because the Part D for drugs, is your prescription drug plan. It generally has some premiums and other out-of-pocket costs, either flat copays for each medication or a percentage of the prescription cost. The average nationwide monthly premium is $33.19 for 2019, and the cost will differ vary um, on where you live, and they may also have an annual deductible. Medicaid is health coverage program operated by the state. So remember, Medicare is federal, Medicaid is by the state, which with broad federal guidelines. Although the federal government pays a portion of the cost, Medicaid is administered and operated by the state in which you live, and each state's program is a little different, so it depends on the needs of that state. Who qualifies for Medicaid? You may qualify for free or low cost care through Medicaid based on income and family size. In all states, Medicaid provides health coverage from some low income families and children, pregnant women, the elderly, and people with disabilities. Some states, the program covers all low income adults below a certain income level, so it's based on the poverty level. There's also another form of Medicaid is the Children's Health Insurance Program, or CHIP. It provides health coverage to eligible children through both Medicaid and separate CHIP programs. CHIP is administered by each state according to federal requirements. The program is funded jointly by the state and the federal government, so they have small premiums for this. Medicaid, there are certain Medicaid benefits that are mandatory. So the benefits that are mandatory are the inpatient, outpatient services, home health, physician and nurse facility services, family planning and nurse midwife services, rural health clinic services. Also, federally qualified health centers fall under that. Transportation to medical care, lab and x-ray services, and tobacco cessation counseling for pregnant women. Optional benefits for adults enrolled in Medicaid would be prescription services, dental services, optometry, podiatry, speech, case management. Now, if the child has CHIP, dental is covered. It then becomes a mandatory benefit, as well as vision. What is the cost for Medicaid? For most health services, you won't pay anything or you'll just have a small copayment at the time of your visit. Most often, you show your Medicaid coverage card and the state pays the full cost of your care to the doctor directly. Some states, under a federal waiver, charge a monthly premium of $20 to $75 for certain eligibility care categories. And I put a Medicaid managed care picture right here, and it just shows more individuals than ever rely on Medicaid for health plans and how it has increased, that more individuals are requiring Medicaid for coverage, and it could be due to the economy. Um, Also, it shows that it's by Catherine and myself, and here's a list of our references. I hope that you enjoyed our presentation. Thanks.